Welcome back to the Coleman Regional's Better Health Now podcast. Super excited to have you here today. Would you like to introduce yourself and we'll get started there?
Yeah. My name is Katie Basch. I'm a nurse practitioner and I work in orthopedics with Dr. Ojard and Dr. Gould.
Yeah, and so talk a little bit about your journey to get here to Coleman Regional. What kind of prompted you to get into the medical field at all?
So I had a grandmother that had a lot of medical problems, and that kind of led me to want to become in the medical
Mm,
field, to become a nurse. While I was in nursing school, I just really was drawn more toward the nurse practitioner aspect of it. So I started early on pursuing that degree. So I worked 3 years on the floor doing just floor nursing
mm,
as a registered nurse. And then I started nurse practitioner school. I graduated in 2016 from University of Alabama in Huntsville and just kind of started from there.
yeah,
I've worked in Coleman as a registered nurse, and then once I finished nurse practitioner school, I actually worked for another orthopedic surgeon here in Coleman.
okay.
So that kind of sparked my interest in orthopedics, I guess
Yeah,
you could say. So I worked with him for 2 years, and then I did some urgent care, primary care for a couple of years, and then I did telemedicine during the COVID
mm,
ordeal.
yeah.
Worked from home for a few years, and then I came back to orthopedics. So
Awesome.
here I
Wow.
am.
Here's like a full circle moment.
Yeah, yeah.
We're talking a little bit about the ONP-C certification
Mhm.
today. Talk a little bit about what that certification is and sort of what are the credentials to acquire that certification.
Yeah. So the certification, what it does is it advances patient care in orthopedics by providing patients with a more specialized orthopedic nurse practitioner. So in nurse practitioner school in the programs, they don't really, I mean, we touch just the surface of
Mm,
orthopedics and certain specialties, but we don't get an in-depth review of that content. So the ONP-C certification, what it did was it prepared me to be able to develop that deeper understanding and to be able to treat orthopedic conditions more accurately.
yeah.
So to obtain that, you do have to have 3 years as a nurse practitioner practicing. You have to have 2,000 hours of seeing orthopedic patients,
Wow.
musculoskeletal conditions, and then you're able to sit for the board exam then.
Wow. And
Mhm.
how like is there like a study process for the board exam or is it just your
Yeah,
application of those years of experience prepares you for it?
yeah. So I did a board review
Okay.
because a lot of the topics included different types of fractures and how they would be treated surgically. So
Mm,
questions that would be for the surgeon. So
okay.
it prepared me to be able to understand, if we see a hip fracture, how would that hip fracture be treated? Would
Mm,
it be surgical? Would they need a hemiarthroplasty or, the other types of procedures that we do? Um, and then we also do it works on or hold on. It goes through degenerative joint disease,
okay.
pediatric conditions, congenital disorders, rheumatologic conditions.
So it's a pretty encompassing,
Yes.
sort of, certification to get.
Yes.
It's not something that's just on a like it the though it deals with the orthopedics side of things, there's so much that it kind of covers,
Mhm.
and you're able
Yeah.
to kind of really get like a full grasp of everything that you would be doing. This certification is not one that's common. There
Right.
is I think you're one of 4 nurse practitioners in the state of Alabama
Mhm.
with this certification. How does that kind of set you apart, with the role that you do on a daily basis?
Yeah. So, with that, I think the certification has been around since 2006, is what I
Mhm,
researched and what they have on the board site. But I feel like that there's not a lot of nurse practitioners that actually work in orthopedics.
mm.
You would see more physician assistants just based off their training versus the nurse practitioner training that we go through.
You're one of only 4 nurses in the state of Alabama that has a certification. As you acquire the certification, how does it set you apart from maybe other nurse practitioners or other people looking for this?
It sets you apart because you do have a deeper knowledge and better understanding of treating musculoskeletal and orthopedic conditions.
Mm,
So, like I said earlier, just with the training that we have, where we skim the surface, it gives you a deeper knowledge. You also are prepared to be able to, like I said, be able to look at something and see, okay, well, how would the surgeon
mm,
treat this, or what surgery would he provide? Even though you're not making those decisions, those are, of course, always left up to the
yeah.
surgeon. it does help me to kind of know, okay, and they're going to go in this
Yeah.
direction.
In this scenario, this is more like most likely what they're going to be doing, and
Right.
then from this, it'll look like this. So like those conversations with the
Hmm.
patients are a little bit easier on your end because you're able to have a better idea of the whole grasp of what's going on.
Right. Right.
Is that sort of the what would a patient, I guess, as they're looking to seek orthopedic, like an orthopedic surgery of some kind, looking at a provider that does have a ONP-C certification versus maybe one that doesn't, is like, what are some of the benefits of that?
So they would have confidence in knowing that the nurse practitioner or the provider that they're seeing has more specialized
Mhm.
training and experience. I also have, work
Yeah.
experience in the field as well. But that's mainly why that I got the certification. I just wanted to better serve our patients that we're seeing. I
Mhm.
wanted them to have confidence in me, knowing that I do have this specialty certification, that I am trained in this area, that even though I'm a nurse practitioner, I'm not the orthopedic
Mhm.
surgeon. I am trained to be able to provide the best orthopedic care that I can provide.
Yeah, and so as far as, I mean, obviously, like, you have that, like, application experience of, being in the field and doing it,
Mhm.
but then you also have that experience of taking the certification and getting that credential.
Mhm.
Would you say that the knowledge that you have for the role that you do here at Coleman Regional is split evenly between the experience and the actual certification board, or is it more lenient on, or more leaning on the actual experience of you just working in it?
Yeah, so I would say the board certification is kind of the icing on the cake.
Mm,
So it gives me a little more credibility in the specialty that I'm in, just because I do have that certification.
yeah.
But the experience has really built the basis, and
Mhm,
what I have learned, working. I've worked about 5.5 out of the 8 years I've spent as a nurse practitioner working alongside orthopedic surgeons. So the knowledge that they've passed to me has really helped me build a good foundation
mhm.
in
So,
that.
in your typical with the typical patients that you see, is there a particular injury or a condition that you're most commonly treating?
Yeah, so we see a lot of osteoarthritis. So obviously, degenerative joint disease. We see acute injuries, fractures. We see a lot of fractures, but so that's a lot of what we see. But we do have the occasional, bony tumors that come in that those are obviously not
Mhm,
expected that we'll see. Pediatric conditions, different masses or things that we may find on MRI that
mhm.
we weren't expecting to see. So there's a few things that here and there that we see that's not common, that it's good to be prepared for, to be able to treat those conditions or be able to refer to the appropriate provider that does treat
Mm.
that condition.
So, what else would you like the community to know about the care that you provide or that's provided here at Coleman Regional?
So for me personally, I grew up here in Coleman. I'm a Coleman native, have always lived here. So I've just always wanted to, be able to give back to my community in some way. So, going to nurse practitioner school, being able to treat patients and to be able to care for them, I feel like that, me personally, I try to do everything to the best of my ability, which
Mm,
I feel like most of us here at Coleman Regional do. But Coleman's a small town, so I feel like that we're growing and the
mm,
hospital's growing and offering more options for patients so that they don't have to go to Birmingham or Huntsville, or
mm.
some of the bigger cities to be treated. So I think that being able to keep patients here, keeping them close to home, being able to do a good job at treating them as
Yeah.
well. So being able to be knowledgeable in our specialties and in our areas that we're treating these patients in.
Yeah, and I feel like that's part of the conversation we have with everybody on is
Hmm.
is just being able to offer more things here
Right.
and kinda be able to support Coleman County and the area and all the areas surrounding it, so you don't have to do, like, an hour and a half drive
Hmm.
to wherever to get that specialized treatment. We'll be sure to have everything in the episode notes with information about the conversation and anything that people can find links to, but I appreciate you being here today.
Yeah, thanks. I'm so glad to be here. Thank you for having me.